Let's be honest about something. The moment most people get their first puppy, it feels like they are ready. The research has been done, the food is bought, the little bed is set up in the corner. How hard can this be? Then the puppy arrives and reality hits. Having no idea what to do is completely normal. Taking care of a puppy and taking care of an adult dog are two completely different experiences, and most people are not warned about just how different they are. This guide covers the real differences: feeding, training, health, behavior, and more, so anyone thinking about getting a dog or already owning one and feeling confused can understand what's happening. Food is usually the first challenge new dog owners face. Puppies need to eat more often than adult dogs. A puppy's stomach is small, and their body is growing fast, burning energy quickly. Most puppies need 3 to 4 meals a day in the first months. Adult dogs usually do well with 1 or 2 meals a day. Feeding is not just about timing, it's also about the right food. Puppy food is made to support growth, with extra protein, fat, and nutrients for development. Giving a puppy adult food too early means missing vital nutrients, while feeding adult dogs puppy food for too long can cause weight gain and health problems. Timing and proper nutrition are essential. Vets will advise when to switch to adult food, and following that guidance ensures optimal growth. Delaying the switch because the puppy seems fine is a common mistake, but fine is not the same as healthy or ideal. Vaccines and health checks are another area where mistakes happen. Puppies require a series of vaccines during the first few months, given in stages, because their immune systems are still developing. These early vaccines protect against serious illnesses like distemper, parvovirus, and hepatitis. Adult dogs still need vaccines, mostly booster shots, but the schedule is less strict. Missing a vaccine as a puppy cannot always be fixed later in the same way. Puppy health checks also involve checking for worms, parasites, and proper development. Adult dogs still need regular vet visits, but the focus and frequency shift as they age. Training is where the difference is massive. Training a puppy is exhausting but crucial. Puppies are like sponges. Everything they experience shapes who they will become. The first few months are critical for teaching house rules. Housebreaking, teaching them where to go to the bathroom, is urgent. Puppies cannot control their bladders yet, so accidents happen. Patience is mandatory. Punishment does not work like it might with adult dogs. Puppies cannot connect a correction to an action minutes ago. Everything must be immediate, consistent, and calm. Raising a voice or showing frustration teaches anxiety, not lessons. Adult dogs can be trained successfully, especially adoptees, but the foundation is usually set in puppyhood. Early consistency saves trouble later. Socialization is another key difference. Exposing puppies to people, animals, sounds, environments, and situations builds comfort and confidence. There is a window, roughly 3 to 14 weeks, where socialization is most effective. Positive experiences shape lifelong reactions. Puppies exposed to diverse, safe experiences are more likely to be friendly and confident adults. Isolated puppies, or those with negative early experiences, may grow anxious or reactive. Socialization should be slow, positive, and consistent. Adult dogs can be socialized too, but patterns are already set, making it more time-consuming. Exercise is often misunderstood. Small size does not mean less activity is needed. Puppies have high energy but developing bones and joints, so excessive hard exercise, long runs, or high jumps can cause damage. Short, frequent play sessions are best. Adult dogs, depending on breed, can handle more activity and need it for health and calmness. Bored adult dogs with excess energy may develop behavioral issues like chewing, barking, and destruction. The goal is the right amount and type of exercise, not exhaustion. Sleep patterns differ dramatically. Puppies sleep a lot, 16 to 18 hours a day. Growth demands energy, and sleep is critical. Schedules are irregular. Play, short bursts of activity, crash again. Early weeks can feel chaotic. Adult dogs sleep more than humans expect, but schedules are predictable and manageable. Teething is another challenge. Puppies lose baby teeth and grow adult teeth, making gums sore and driving chewing behavior. Shoes, furniture, and hands all become targets. This is natural, not misbehavior. Appropriate chew toys, soft rubber, rope, puppy-specific items help relieve discomfort. Adult dogs chew too, but it is usually boredom or anxiety rather than teething, requiring different strategies. Grooming is another area where early habits make a big difference. Puppies should be introduced slowly and gently to baths, nail trims, and brushing to reduce fear. Puppies comfortable with handling are easier to care for as adults. Adult dogs not accustomed to grooming can be difficult at the vet or groomer, sometimes creating safety concerns. Bonding is also different. Raising a puppy builds a personality together. They learn trust, safety, and boundaries with a primary reference. Adult dogs, especially rescues, already have histories. Watching them learn to relax and trust can be deeply rewarding, but patience and expectations differ. Both stages of dog ownership are beautiful and hard. Puppies are loud, chaotic, and all-consuming. Adult dogs can bring challenges, particularly if they come from tough backgrounds. Success depends not on the stage chosen, but on preparation for what that stage actually looks like. Knowing what to expect turns stress into enjoyment. Thanks for watching. Please subscribe for Japanese and Korean language learning content, fun ESL class stories, sometimes even the toxic ones, plus videos about pets, plants, and anything interesting worth sharing.